Healthcare Providers of Color for Children of Color. This presentation was created specifically for those professional healthcare providers that ethnically recognize as persons of color and/or as Black, Indigenous persons of color. In the United States, people of color include African Americans, Asian Americans, Native Americans, Pacific Islander Americans, multiracial Americans, and Americans from all Latin countries. What is considered a healthcare professional? A physician or other qualified healthcare professional is an individual who is qualified by education, training, licensure/regulation, and facility privileging, who performs a professional service within his/her scope of practice and independently reports that professional service. What are examples of healthcare professionals? Medical professionals include doctors, nurses, hospice workers, emergency medical technicians, physicians, nurses, nurse practitioners, physician assistants, pharmacists, social workers, dietitians, physical therapists, occupational therapists, medical technologists, and other professionally trained and/or certified trained caregivers. The goal of this presentation is to identify healthcare providers that identify as a person of color and/or a Black Indigenous person of color, to introduce those healthcare providers of color to a large population of children of color who have caregivers that are invested in having their children receive healthcare services by providers that look like them, and to convince those healthcare providers of color to join our private network. Who are we? The Collaborative for Better Urban Health is a children's healthcare coordination company born from a clear unmet need for quality healthcare services offered to children of color by professional healthcare providers that look like them. Our mission: to drive optimal health within communities of color by empowering clients through healthcare literacy and direct access to optimal healthcare providers of color that they trust. Our vision: to reduce healthcare burdens by educating clients and providing direct access to quality primary care, which in turn reduces the number of emergency room visits, empowers parents to be an active participant in their child's health outcomes, and contributes to a more balanced city and state economy. Our values: to transform the complete healthcare experience for children of color through partnerships based on transparency, honesty, and trust. We aim to be the optimal partner in healthcare coordination, empowering our clients to help us create a new standard for children's healthcare. Our goal: to strengthen the position of the Affordable Care Act by becoming the single largest healthcare coordination network in the country for children of color. Additionally, increasing the quality of life for people of color in urban communities through a new generation of healthy children. What are we doing? Providing quality healthcare coordination and quality healthcare management to children of color by healthcare providers of color that have earned their trust. How are we doing it? By building our own private healthcare network rooted in the following 5 principles: whole person assessments, healthcare literacy, a new standard of care, direct relationships, accessibility. In order for us to effectively change the poor healthcare narrative in communities of color, we urgently need healthcare professionals in the following fields, included but not limited to: neonatology, pediatric allergy and immunology, cardiology, developmental and behavioral issues, endocrinology, gastroenterology, genetics, hematology, nephrology, neurology, oncology, orthopedics, pulmonology, rheumatology, urology, psychologists and sociologists, nurse practitioners, and any person of color who is a healthcare professional that is interested in joining us. What is healthcare coordination? Healthcare coordination tracks, schedules, and manages a client's health and social determinants services. This process involves the client's care manager organizing all of the client's social determinant and healthcare activities and sharing that organized information amongst all the participants connected to that client's care. This helps to achieve safer, more effective, and seamless care. What does that look like? We refer our clients to quality healthcare providers of color within a private network that we've built. Each of our providers have agreed to the following things. Transparency. Each provider has volunteered the total transparency of both their educational and professional history. Commitment. Each provider has committed to a professional code of ethics that we've created based on data collected from client satisfaction surveys. Pledge. Each provider has verbally pledged to partnering with us in educating, training, and empowering people of color to make more informed healthcare and quality of life decisions for themselves, their children, their families, and their communities. How does it look on the ground? One-to-one care management? Care management is a set of activities intended to improve patient care and reduce the need for additional or extended medical services by enhancing the coordination of care, eliminate duplication of services, helping clients and caregivers effectively manage their health and outcomes, less stress, confusion, and resistance. The care manager is the one person solely focused on the care of the client. This one person brings everything together to create one successful stress-free process. Today's social work help system has multiple sub-level providers that are trained to think that their specific program or service is more important than someone else's. This results in a client being assigned multiple sub-level providers who pull clients in different directions. This tactic places clients under unnecessary stress, which further results in the client shutting down and either not participating in any services offered or abusing a clearly broken system. Speak to me and I will speak to my client for you. Often, when clients are speaking with social service workers and/or healthcare staff, they nod their heads in agreement to understanding matters when they genuinely do not understand. Part of the Better Urban Health new standard of care means if a client has mandates with 6 to 7 different programs, as opposed to staff from those 6 to 7 different programs, simultaneously contacting the client into scattered choices, the staff from those 6 to 7 different programs will contact the client's one care manager. That one care manager will absorb all of the information from those providers and sit with the client to create one manageable calendar of appointments, ensuring that there is no duplication of services, and then assist the client with attending all appointments. How are we different? This is Dr. J. Corey Williams, a psychiatrist in Baltimore. According to Dr. Williams, who received his medical degree from Johns Hopkins University School of Medicine and has been in practice between 3 to 5 years, many Black Americans do not trust their healthcare providers to act in their best interest. Research has shown that Blacks are much less likely to report lack of trust in their physicians and hospitals, thus are also less likely to seek treatment or to be compliant with the recommended treatment plans. The medical community should care about this collective sense of Black distrust in medicine, as it is a major factor in the well-documented health disparities between Blacks and whites. Okay, so what does trust look like in today's climate? Healthcare providers for us, from us. Interesting. Okay, so what does the Better Urban Health team look like? Our motivation. The Black men pictured above were the owners of the properties in the Black Wall Street area of Tulsa, Oklahoma. On May 31st, 1921, these 58 Black men and 800 additional Black men, women, and children were murdered, and the properties that they owned were destroyed for 2 reasons. 1, being Black, and 2, being too successful. 100 years later, Better Urban Health is on a mission to help reestablish what was stolen from us, beginning with healthy children. Our growing team at Better Urban Health currently consists of 75 providers of color that have already made the commitment to help your children. What do we need? We currently have membership access to a growing list of over 1,000 Black and Hispanic children. For us to continue to deliver an outcome-driven model that addresses the healthcare disparities associated with complex trauma, the social determinants of health and healthcare provider distrust, we need 3 things. More providers of color to become active members of our network. For those members to accept Medicaid as the sole payment option for all services. For those members to partner with us in reestablishing trust to communities of color. How do you define providers of color? Person of color? According to the Merriam-Webster Dictionary, the definition of person of color is a person whose skin pigmentation is other than and especially darker than what is considered characteristic of people typically defined as white, and or a person who is of a race other than white or is of mixed race. Provider of color? A federal or state professionally licensed person of color who specializes in a skill or skills that he, she, they are willing to use in partnership with Better Urban Health to combat the social determinants of health that plague people of color in urban communities. Do people of color really have better healthcare outcomes when they're paired with providers of color? Yes, minority patients do benefit from having minority doctors, but that's a hard match to make. A Stanford University study paired Black men in Oakland, California, with either Black or non-Black doctors. The men seen by Black physicians were more likely to engage with them and even consent to preventive services like cardiovascular screenings and immunizations. Additionally, the study found that Black doctors were more inclined to write detailed notes about their Black patients. Those men who had the least trust in the medical system benefited the most from racial/ethnic concordance. This study estimates this approach could reduce the Black-white mortality gap due to heart disease by 19%. Food for thought. You should know that the Association of American Medical Colleges is a nonprofit organization based in Washington, D.C. that was established in 1876. It represents medical schools, teaching hospitals, and academic and scientific societies while providing services to its members' institutions that include data from medical, education, and health studies as well as consulting. The AAMC administers the Medical College Admission Test, operates the American Medical College Application Service, and the Electronic Residency Application Service. Along with the American Medical Association, the AAMC co-sponsors the Liaison Committee on Medical Education and the accrediting body for all U.S. MD granting medical education programs. The AAMC is universally respected as the credentializing authority for all American doctors. According to the Association of American Medical Colleges, as of July 1st, 2019, there were 45,534 Black doctors, 53,526 Hispanic doctors, 8,932 mixed-race doctors, 2,570 American Indian/Alaskan Native doctors, 157,025 Asian American doctors, and 941 Native Hawaiian/Pacific Islander doctors, for a total of 268,528 doctors of color. Of that, 268,528, only 99,060 are Black and Hispanic, versus 516,304 white doctors. If this data is true, then what's the doctor of color ratio to the population of people of color? Doctor of color to client of color ratio. According to Google, as of July 2019, there were 102,470,000 Black and Hispanic people in the United States, 41.99 million Black, and 60.48 million Hispanic. According to the AAMC, as of July 2019, there were 99,060 Black and Hispanic doctors in the United States. Therefore, when we look at the data as it correlates to doctor of color to client color ratio, there's approximately one doctor of color per 1,024.7 people of color. But we already see this when we visit our local hospital and see that one Black or Hispanic doctor as he or she walks past us. Wow, that's a lot. I am just one person. How can I help? The lack of Black doctors is literally killing Black babies. Black newborns are 3 times more likely than white newborns to die when cared for by white physicians. According to a new study tracking 1.8 million hospital childbirths over more than 2 decades. But when they are cared for by Black doctors, Black newborns are far more likely to survive, as their mortality rate is roughly cut 50%. Okay, I am interested. So, how do I become a member? What exactly is the membership process? First, the Better Urban Health Provider Network is private. Providers that are members can only have access to our clients via referrals from our staff. Provider Network membership involves a very simple 5-step process. Completing an enrollment application, allowing us to run a criminal history records check, allowing us to confirm your professional credentials, signing a memorandum of understanding, verbally taking the Better Urban Health Service oath/pledge. Once steps 1 through 5 are successfully completed, your application will be reviewed by our board. If approved, you will be notified electronically. You will then be introduced to our staff as a member and will begin to receive direct referrals from us. Okay, so what exactly does membership involve? Money? I've been approached by organizations like this before, and the bottom line is money? What exactly does membership involve? We are not just asking for money. We are asking for a commitment. The primary focus of our provider enrollment and membership is rebuilding trust in communities of color, empowerment through literacy, driving quality, measurable health outcomes. We asked 100 mothers, what are some of the things that healthcare providers can do to A, gain your trust as a mother, and B, convince you to allow them to treat your children? We took the results of that survey and turned some of the answers into what we call the Better Urban Health Trust and Care Commitment, which is included in the Memorandum of Understanding. Help wanted. Critically thinking, outcomes-oriented healthcare providers with the ability to, and not be afraid to, push back against societal norms and think outside the box. If this describes you, please continue. When shepherdized, the 1968 National Advisory Commission on Civil Disorder, also known as the Kerner Report, and data collected in 2021 using the same categories, the data confirms over the last 53 years, communities of color are still grappling with some of the exact same issues. The social determinants of health. According to health.gov, social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affects a wide range of health, functioning, and quality of life outcomes and risks. Data has consistently shown that life for people of color in the United States is on the decline, and part of the decline has been due to preventable causes and social determinants of health. This falling life expectancy underscores what the World Health Organization knew when it wrote within its own constitution that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. According to the National Child Traumatic Stress Network, complex trauma describes both children's exposure to multiple traumatic events, often of an invasive, interpersonal nature, and the wide-ranging long-term effects of this exposure. They usually occur early in life and can disrupt many aspects of the child's development and the formation of a sense of self and/or self-worth. Complex trauma and the social determinants of health. According to Black childhood trauma specialist Dr. Nadine Burke-Harris, treating illnesses is very important, but it would be a mistake to think that only physical illness is the full extent of health. There are other components that play major socio-economic drivers, like education, income, community's health, social connection, and health behaviors. These things count for 75% of what makes up health. According to the National Child Traumatic Stress Network, complex trauma describes both children's exposure to multiple traumatic events, often of an invasive, interpersonal nature, and the wide-ranging long-term effects of this exposure. They usually occur early in life and can disrupt many aspects of the child's development and the formation of a sense of self and/or self-worth. According to the World Health Order in health.gov, 5 things characterize social determinants of health: healthcare access and quality, economic stability, education access and quality, current neighborhood and belt environment, social and community context. Characteristic number 1 of the 5 characteristics of social determinants of health is quality, affordable healthcare, and access to that quality healthcare. Okay, so far you have convinced me. I'm interested. However, I am already extremely busy in my everyday practice. If I join your network, 1. What will I have to do? And what will it look like? Once you successfully complete the steps to join our network, we will advise our staff and clients that you have joined us. Your name and office contact information will be directly given to our staff and included in our referral directory. You go on living your regular daily life with your regular daily responsibilities. Whenever one of our staff members has a client that needs your specific expertise, that staff member will contact your office, work with your staff to schedule an appointment for his/her client, give the client the referral, and then work with the client to make sure that the client keeps the appointment. Okay, so how do I help if I do not have a private practice? If you are a healthcare provider without a private practice and are interested in joining us, great! Once you successfully complete the steps to join our network, we will advise our staff and clients that you have joined us. Your name and professional contact information will be directly given to our staff and included in our referral directory. You go on living your regular daily life with your regular daily responsibilities. Whenever one of our staff members has a client that is having a case conference meeting, if your expertise is needed, with notice in advance, that staff member will contact you to advise you of the meeting. Your responsibility would be to attend, either in person or virtual, and offer your professional, unabridged opinion as it correlates to the absolute best care for the child. At Better Urban Health, our first priority is to secure a private network of quality healthcare providers, followed by becoming the gateway to better healthcare for children of color in NY State, and then out the nation. Why? Children that look like us are hurting, and it's our responsibility to help make it stop. Better Urban Health, please join us. If you are a healthcare provider of color, and you are interested in offering your expertise to a population of children that not only look like you, but will also look up to and probably want to be like you, please join our network. We need you, but they need you more. Email us at betterurbanhealth@gmail.com. You can call us at 646-600-4570. Or you can click the link below to complete our provider registration form.